Thank you for being here with us today for our exciting conversation and presentation and hopeful discussion. I'm thrilled to see so many of our colleagues at the Goldman School of Public Policy. But for those who are coming from elsewhere, my name is David Wilson. I'm the Dean of the Goldman School of Public Policy and a Professor of Public Policy and Political Science here at University of California, Berkeley. And it's my pleasure to welcome everyone to our event and welcome to all of our speakers. First, we have a little bit of housekeeping. I've got notes. When you came in, you should have been handed an index card. If you have one, wave it in the air. Good. Thank you. Now, these are for drafting questions to share with our speakers following each of the presentations and during the discussion, and we'll try and get to all of your questions and comments. I also have a note here that we will accept high-quality doodling and any good jokes you might have. So those are acceptable. Just make them legible so we don't make any mistakes on wording. Joe and Alex, can you wave your hands, make noises, scream? Joe and Alex will be receiving the questions that you offer through the index cards. So in between and during sessions, you can gladly pass them to Joe and Alex. And also just a note for those who are joining us from the virtual world, we'll be recording the talk today. And so the discussion and presentation will be available in the future. And for those who are joining us in the future, welcome as well. So there's some very critical questions that we've come to talk about today and serve as the foundation for the event. And that's how we as a public deliver aid to the most vulnerable populations in our country. During the COVID-19 crisis, we saw enormous expansion of the social safety net through policies such as the child tax credit, expansions in the Supplemental Nutrition Assistance Program, or SNAP, the Unemployment Insurance Program, and direct relief payments to individuals and families. Social safety net policies have always raised questions about politics. That is, who, what, when, and why. Who, what groups or populations are deserving of the aid that we provide? The what kinds of conditions should be attached to the distribution of economic and nutritional support, and what forms should that take? When should these programs start and when should they end? And why? Why should the public care? And why should government be the ones to act? The questions remain today, and over the last year, the policy expansions that we saw during COVID have largely gone away. And not surprisingly, we have seen increases in child poverty and in the hardships related to nutrition, housing, and childcare security, among other issues. So our speakers will address the policy and political landscapes that we're experiencing today and offer some valuable research and perspectives to help us sift through the noise and the politics and focus on the evidence, help us understand what really works. So I'm thrilled to introduce our speakers for today. First, we will hear from Hilary Hoynes, who is the Associate Dean of the Goldman School of Public Policy, Haas Distinguished Chair in Economic Disparities, and a Professor of Public Policy and Economics here at UC Berkeley. She's also faculty director at the Berkeley Opportunity Lab, which is co-sponsoring the event tonight. Professor Hoynes is the national expert on state and local national policies. I should say the national expert on state and national policies that address child poverty and family economic security. Among other distinctions, Professor Hoynes played a key role and was a key author in the National Academy of Sciences 2019 Roadmap to Reducing Child Poverty Consensus Report. She's a member of the National Academy of Sciences, the American Academy of Arts and Sciences, and the National Academy of Social Insurance. And she serves on the Governor's Council of Economic Advisors. That's at least 3 jobs in addition to her professorial jobs and being an all-around good person. So please welcome Professor Hoynes. Following Professor Hoynes' presentation, we will hear from Adam Levy, Professor of Public Policy at the Goldman School. Professor Levy is a health economist, health economist and data scientist who studies a range of social insurance programs and social welfare policies. His work has been published in some of the top economics and health policy journals in the country, and his recent research on health savings accounts received the 2022 TIAA Institute's Paul A. Samuelson Award for Outstanding Scholarly Writing on Lifelong Financial Security. That's a big deal, man. Congratulations. Professor Levy is now leading some impressive research on the impact of work requirements for SNAP, and we're excited to hear some of your work today. So please welcome our very own Professor Adam Levy. All right. And following Adam and Hilary's presentations, we'll have a short conversation moderated by another GSPP All-Star, Sakina Shabazz, Policy Director of the Berkeley Food Institute, another co-sponsor of this afternoon's talks. Director Shabazz is an alumna of the MPP program, class of 2022, my first graduating class. Yes, it was. Prior to GSPP, she worked in Washington, D.C. for the Congressional Hunger Center and the Food Research and Action Center. In these positions, she led large policy implementation and policy feedback programs and projects that served some of our country's most vulnerable populations. Good work. When Director Shabazz matriculated to the Goldman School in the fall of 2020, she immediately began undertaking policy research and wrote about the impacts of the COVID-19 pandemic on food access for older adults, gig economy and grocery store workers, restaurants, and the California Health Soils Program, and much more. She currently leads the state and federal policy engagement for the Berkeley Food Institute, serving as policy co-lead on the California Farm and School Incubator Grant Evaluation Project, and lectures on the U.S. Farm Bill and food and agricultural policy more generally. Please welcome Director Shabazz. All right, last words. Just a reminder to pass your questions to Joe and Alex. Once again, Joe and Alex, raise your hand. In the aisles for the final Q&A. And with that, I will hand things over to Professor Hoynes. Welcome.
All right, thank you so much. And as David, in his very kind introduction, said, I am the director of the Berkeley Opportunity Lab, one of the sponsors of this event. And so in that capacity, I welcome you all here today. So what I'm going to do here is do a little bit of sort of context setting. We all may come into this room with different amounts of information about what is SNAP, what role does it play in the U.S. social safety net. And so I want to kind of give a landscape of this really important program and how it impacts well-being of individuals, families, children in the United States. And then I'll turn it over to Adam to really draw in and draw out this really critical element that is the role of work requirements in our social safety net and in SNAP in particular. So let me start by just making sure we all have some shared view and knowledge about just the prevalence of poverty and low incomes in the United States. So this gives you just a trend of poverty rates for all persons and children in particular. And, and I should say before going further, most of the beginning of my comments are all going to be showing you data up until and through 2019. And then I'm going to end with talking about COVID. So this data goes through 2019. The United States is a country with very high levels of inequality, and looking at these high levels of poverty, which are high compared to other rich countries in the world, is one dimension of inequality. That is lower tail inequality, the prevalence of low income in the United States. In addition, and really important to today's conversation and the role of SNAP in the U.S. social safety net is also the prevalence of something called food insecurity. How many people have heard the term food insecurity? Awesome. This is not an audience that doesn't know things, so bravo to all of you. So food insecurity is something that the USDA measures and has measured since 2000? 1997. So relatively recently, it's a federal statistic that's released every year, and usually in February, that tells us about food insecurity in the year before. And this gives you just a landscape of the rates of food insecurity, which is generally speaking about the essentially not having enough money to have adequate food, in short. But there's like 10 questions that are used that people answer, things like, More minor things like I was worried food would run out before we got money to buy more. And then as you move down the list, much more extreme things like, were you ever hungry but didn't eat because there wasn't enough money? Did you ever skip a meal? Did your child ever skip a meal? And so these kind of questions are aggregated up to create these measures of food insecurity and very low food security. And the United States has very high levels of food insecurity. So more than 10% of people in 2019 were defined as food insecure in the United States. So that brings us to SNAP, or Supplemental Nutrition Assistance Program, which most people also might call food stamps, which was the official name of the program until it was renamed relatively recently. And it is the main element of our social safety net in the United States that is specifically targeted at lowering food insecurity in the United States. Benefits are distributed via debit card today, although there was a time when there was actually like a currency that was actually distributed through the Federal Reserve, like currency. And you essentially are allowed to buy any food in the grocery store or in any other store that accepts these debit cards for the purposes of supplementing your ability to pay for groceries out of pocket. And you want to think about food stamps as providing a benefit of about $4 per person per day. And if anyone ever in the room ever done the food stamp challenge to try to live within $4 per person per day, it is not easy. Who is eligible? Essentially, you need to have income below around 130% of the poverty line. So it's serving the poor population. And in 2019, there on the cusp of COVID, the program served about 36 million people in about 18 million households at the cost of about $60 billion a year. And interestingly, just like most consumers, most dollars on SNAP are spent at large grocery stores, a lot at superstores. And because the benefits are denominated in dollars, here's $200 on a debit card, individuals who are receiving SNAP benefits are price sensitive just like the rest of us are. It's just adding dollars to their food budget is the way that you want to think about it. So who is on SNAP in the United States? It's a large group are families with children. 44% overall are children on the program. Also, a large share are elderly or disabled. And then, of course, there are adults, many with children, and particularly what Adam will discuss is the group of adults without children. So what I want to do with that, just like basic, like what is SNAP, I want to go through the things that come to mind to me as sort of a scholar of the social safety net broadly to try to illustrate why SNAP is so important. So why does SNAP matter? And I'm going to go through about 5 elements, I think, if I remember correctly, that I put together. So the first one is it's not the kind of thing that a nutritionist would think about when they look at SNAP, but it's someone who's a social safety net scholar would. The first thing is that I like to say that SNAP is the fundamental safety net in America. And the reason for that is that most of our programs in the United States are targeted on one group or another, or conditional. You have to work to get it, for example. And SNAP is the closest thing to a program that's universally available to those who are income eligible, meet that income requirement. And so that makes it a very important part of our social safety net. Secondly, probably the most researched thing about SNAP is, well, how does it affect food insecurity? And study after study after study, using different approaches, different time periods, different populations, consistently shows that having access to SNAP or expansions in the generosity of SNAP lead to very dramatic reductions in food insecurity. So it is effective at its stated goal. And the figure that I show here is just a very simple illustration of that. The blue bars are tabulating food insecurity rates of a cohort of individuals who on the cusp of entering SNAP. And the blue bars indicate what those same groups' food insecurity is 6 months later after they've been on SNAP. And of course, there's many, many other studies. So thirdly, SNAP is one of the largest anti-poverty programs in America. This figure here comes from the census's most recent annual poverty report that was released in September. And it tabulates each one of our elements of the social safety net and the number of individuals who are raised out of poverty from that program, and then puts them in buckets. The elderly is the light blue bucket. 18 to 64-year-old adults is the middle blue, and then children under age 18 are in the darker blue. And among children, SNAP is the second most important anti-poverty program in America after the refundable tax credits and tax credits like the earned income tax credit. And it's also the second largest for the elderly after the big gorilla Social Security, which is the biggest anti-poverty program in America, though has less impact on families with children. So fourthly, in terms of why SNAP matters, we now have quite a wide body of evidence showing that, again, access to SNAP or increases in the generosity of SNAP lead to a very wide range of benefits for adults, elderly, disabled, and children. So in particular, focusing on families with children, which is a lot of where the emphasis of my work is, we've got consistent evidence that having more SNAP improves infant health. So for example, when women are pregnant and they, policies expand and they have more or less access to SNAP or a larger SNAP benefit, we see very clear effects on the birth weight, the incidence of low birth weight, and other factors associated with infant health at birth. Really powerful stuff. We see consistent improvements in child health. We see reductions in absences from school. Interestingly, this seems to be a bit less operating through a health channel, like their sick list, and more operating through what I would call reducing the burdens of poverty. And when you've got a little bit more resources in the household, you're just able to keep up with things a little better. And one of those things that you're keeping up with is getting your child to regular well checkups on time, and getting them to school more often. These are the kinds of things that we see very commonly associated with poverty in the United States. There's evidence of reductions in maternal stress, reductions in hospitalizations for vulnerable elderly populations. Fifth, putting my semi-macroeconomist hat on, SNAP is a very effective, what we call automatic stabilizer. What is an automatic stabilizer? When we have a recession, people's consumption goes down. They have less money, they spend less, and that gets us in this hole and makes the recession continue. An automatic stabilizer is something that when we have that kind of shock, we've got something built in that automatically gets people to start spending more. And food stamps, critically, is an entitlement program, which means it's got an uncapped funding element to it. So when demand goes up, the social welfare office doesn't say, "I'm sorry, we've hit our cap this year. We can't provide food stamp benefits." It's available in an uncapped way. And so that turns out to be a really important thing for the well-being of people, and also a pretty important thing for helping out in a macroeconomic downturn. So most recently, my research has mostly been focused on trying to quantify how providing more SNAP benefits when children are young, to what extent that translates to changes in a child's health and economic well-being in adulthood, in order to think about whether or not SNAP is an investment in children and in their future, and therefore also in our society at large. And so that work kind of relies on, in order to evaluate the long-term effects of something, you need to go back in time. And so we go back in time to the origin of the food stamp program, which took place in the 60s and 70s. And it turned out when food stamps was first rolled out, it took about 15 years for it to go from the first counties to the last counties where food stamps was in place. And so we leverage that in a sort of treatment control comparison way, in a sort of difference in difference model, in order to compare children who happen to be born in different counties at the same time, or perhaps in the same county at different times, and therefore experience different exposures to access to the SNAP program. And what we find in that work, let me just give you some specific numbers. A child who has access to food stamps throughout their childhood, and in particular, it seems like the really formative years are up through age 5. Having access to food stamps in those years compared to not having access to food stamps in those years leads to a reduction in mortality. So an 11% increase in survival to the last year we observed them in the data. A 0.5 percentage point increase in not being incarcerated. Increases in college attendance, 7% increase in earnings, a 3% reduction in not being poor, a 9% reduction in receiving social support in adulthood, and a 5% increase in home ownership. So we see this very broad, maybe not super big, but very broad set of benefits of having access to these benefits in early childhood. And so perhaps we'll talk about that more in the Q&A. So before I end, I want to kind of bring us all up to date on what happened during the COVID pandemic. Obviously, we had this unbelievable and dramatic and quick and severe decline, not only to work, but from the perspective of particularly children, the loss of meals at school, which is huge in terms of adding to the family's budget of nutrition. And the policy response, I would say, just within SNAP in particular, was much more robust and far-reaching than anything we've ever done in any other recession. So on average, benefits increased from this emergency allotment, this first wave, by $160 per month per family on average from this increase. And there were subsequent increases that took place first when the first bill when Trump was still president, and then subsequently under the Biden administration. There was also, because all of these welfare offices were closed because we were all not at home, they shut down these, what turned out to be very important frictions and administrative burdens in keeping people on these programs, not work requirements, the in-person interviews, but also waived work requirements. And so what we saw was a lot more spending on SNAP. The higher bar is how much we spent on SNAP during the COVID period, and our spending more than doubled. About a 20% increase in the people on SNAP, so it was mostly providing more benefits to the existing population. Amazingly, poverty actually declined between 2019 and 2020, despite this incredible economic crisis. This is not just because of the expansions to SNAP, but the other elements that Dean Wilson mentioned in his remarks: unemployment, the economic impact payments, and the child tax credit ultimately. That doesn't typically, I can tell you, doesn't usually happen in a recession that poverty goes down. It also doesn't usually happen in a recession that food insecurity goes down. But that's what happened in this period. And so as we come together at the end, perhaps we can talk a little bit more about sort of what we learned from when policies work, when they're well designed, ready to go, targeted, and quick at responding to need. So thank you very much, and I'm more than happy to turn things over to Adam Levy.